Hello, everybody. Thank you so much for joining today. I'm Dr. Bielfield from Westlake Dermatology, and today's webinar is hopefully going to get you a much better understanding and take away any concerns or fear you have regarding fillers, specifically Sculptra and Restylane. Um, So we will move into the discussion. It'll be a very brief discussion, and then we will move into a question and answer session where you can simply just type those into the question and answer panel, and then we'll answer those. So moving forward, I think really an important thing to distinguish is what are dermal fillers. Um, it's really we should think of this more simplistically than I think it's a approach. And essentially, they're just injectable gels. And there's different types and different structures used to approach for fillers. So the two types we're going to be talking about and kind of comparing is hyaluronic acid, which is really the main one that you probably see marketed and available in most offices. And then Sculptra, which really works in a different sort of slower approach, and we'll definitely get into the details of that. And really, why do they work and why are we using them? So, as we age, naturally we lose the soft tissue structures of our face. It starts with the appearance of the outside skin, and that's really secondary to the critical structures under the skin, mainly the fat pads that are under our face and our cheeks and strategically in our face, and also the collagen structures, which are important for basically the foundation or scaffold of our face. And those will together build a foundation that will give you a more natural, euthanizing face. Just a reminder at the end, you can do the question and answer, so you can type those in. We'll address those at the end. So specifically, Sculptra is really important to just understand what is this stuff and why does it work so well? And it really does work quite well. Sculptra is made of a substance called PLLA. Essentially, it's a type of sugar molecule. It's used in dissolvable stitches, which we use every day in skin procedures. And so it's safe. It's been tested for many decades. And what it essentially does is really quite brilliant. What it does is it's a gentle framework that works under your skin. So essentially, you have a dilution of sterile water and of these small Sculptra sugar molecules. You then inject those strategically into the skin. And if you're looking at the picture on the left, the skin structure you see on top there, that tan kind of rippled area, that's what we see from the outside. That's our outside skin. And then on the bottom, you see those little yellow globules, those are the fat. So we're actually targeting in between, almost like a sandwich. You see almost like these spaghetti strands, they're like an orangish yellow color. Those are collagen. And you can see that they're almost like a framework, as if they were holding up a house or a foundation. And that's what the sugar molecules, the cells, are then stimulated to build collagen within the sculpture and gradually build that collagen. And so the common question is, well, why do I have to get so many sessions of Sculptra? Why can't I just have this hyaluronic acid or Restylane product or Juvederm? And why do I have to do this? And the answer really is because this is the most natural way to build volume and structure and definition to your skin and the foundation underneath. Because it's building the most critical substance. It's building collagen, but it does take time. So here's a real world example. This is a patient that was gracious enough to allow us to show their results both before and after. So first, just take a look at the top. And on the top, what I want you to just appreciate is just the generalized volume loss. So this patient came in, they said, I feel fatigued, I look tired looking, I look sunken in. Those may be certain themes that sort of resonate with a lot of you listening right now. And so this patient was the perfect candidate for Sculptra. Why? Because they had that generalized volume loss and the generalized loss of definition and structure to their face. There wasn't a specific area where a filler like Restylane, a hyaluronic filler, you could kind of pinpoint and put it in. They needed a general refresh of their face. And so if you look at the bottom picture, it really is quite amazing that this simple structure, the simple sugar molecule injection can actually have these results because it works by stimulating your own collagen in a very natural way. And so looking at the bottom, paying attention to the cheeks, the cheek volume has been restored to a natural, normal volume. It's not overdone, it's not lumpy. If you look at the laugh lines between the nose and the cheeks, they're present, but they're much more dampened. They're less visible. And you want to retain some of those structures. You want to have, that's how you get a natural look. If you overfill, if you overdo, if you put too much in, you're going to lose the natural structures and texture of your face, and it's going to look very unnatural. So moving on to wrestling, contour, and lift. If you look on the upper right, that's essentially what this stuff looks like. It's just essentially almost like a clear, translucent gel. Again, it is also a complex sugar molecule that your body actually makes naturally. It's in our joints, it's a key structure in our skin. I'm sure you all have seen and heard in topical products and many cosmetic products, hyaluronic acid is a big buzzword, it's a big thing that people want to do. And why is that? Hyaluronic acid is probably one of the most powerful tools we have in dermatology to attract water. Essentially, it's like a great big sponge, and all that water is attracted into the pores of the sponge. And then it does what we really want it to do. It adds volume. And so in this family of fillers, there's two that in particular can be used, and they both have their place. One is Restylane Contour, and one is Restylane Lift. Restylane contour is great for cheek contouring. So what do I mean by that? Meaning that you have lost some volume, but you still have some underlying bone structure, but you need a little help. So this is going to add that definition, allow things to look natural, especially and importantly when you're animating, when you're smiling, when you're having different emotions. Restylane Lift is also a great supplement if somebody's really lost a lot of volume, especially in their upper cheek area. That's where we can put this focally and more meticulously and precisely for deeper injections to give you that stronger lift. This is a patient that is a great example of this hybrid approach for, again, combining both Sculptra and Restylane products. And if you look at the total volume of products, your jaw may be dropping, saying, my goodness, I don't think I would ever do that much filler. But look at this patient. Look at the before on the left and the after on the right. And I think you'd be hard pressed to say this patient doesn't look refreshed, natural, and most importantly, not overdone. Somebody's not going to look at this patient and know what they had done other than they just look good. They look refreshed. So they had 6 vials of Sculptra. That's typically 2 vials on each session, about a month apart. And they had 4 total syringes of Restylane Contour. So yes, that seems like a lot of product, but again, what matters is the result, and the result is natural, and it was done in a staged approach. So again, the key features, just like the last patient, typical things that happen with middle age and aging and volume loss, or even if you have weight loss and things, soft tissues aren't there like they used to be. The mid face, especially the cheeks, have just kind of lost some general structure and volume. Those have been restored again to the key being a natural lift and volume restoration without being overdone. If you look at her laugh lines next to her nose, between her cheeks, those have also softened. Even the kind of under eye areas have softened up. So this really can just refresh and give you a better definition, better texture, and better overall look of your overall face appearance and structure. So going back to results and Sculptra and how long it takes, really patience is a virtue here. The first week you're going to be wowed and think it's amazing because we're putting a large volume of water and the sugar molecules into the skin dermis underneath the top layer of skin. So you're going to see some fullness, and that's really mostly from the water. But that water naturally is going to absorb into your cells and your system over a few days. And then it's going to look like nothing was done. And then you're going to be very impatient and dissatisfied. However, if you wait that first 1 to 3 months, you're going to gradually notice some results. And then typically between 3 and 6 months is when you're going to get that more of that wow effect, that smoother, younger appearance that we saw in those previous patients because that's what's happening. The collagen is building naturally, slowly over time. Depending on the patient, these results can last up to 2 years, and of course, some patients do need touch-ups. Looking at the products side by side, how do you know which one is appropriate for you and how do they work again? Again, the Sculptra is a sugar molecule. It builds collagen on that framework very slowly over a 3 to 6 month period. The Restylane Contour is more a volume restoration more instantly in defined focal areas. I think a great analogy for this is, let's say you have a house that is 10 years old. Naturally, there's going to be some wear and tear on that house, and the foundation is slowly going to sink in, and it's going to lose some of its overlying structure. That's where Sculptra comes in. It's going to rebuild that foundation or structure. In the cases of our face, that's the underlying soft tissue and collagen network, and gradually give you the result you want. And then Restylane Contour and Lift can be like the touch-up paint and the trimming on the outside where you're kind of refining things and giving detailed, focused attention where it needs a little extra work. Both of these products can be used pretty much on so many different areas of the face, depending again on the generalized structure of your face and where your volume loss is. And a really interesting thing is Sculptra is now being used off-label, meaning the FDA hasn't actually approved it for these specific findings, but it's been used successfully in other areas, such as the buttocks, where people want a little bit of a lift. And Restylane Contour and Lift, a great area that many of us didn't really think of, is the back of our hands. Our hands take so much abuse with sun exposure over the years. And so the skin thins out, we lose the collagen structure underneath, and it does make us look a little bit more aged. And so that's a very easy area to target with these fillers, specifically those products. Kind of summing up and putting this all together, what's the goal here? We want to enhance your looks. We want to make you look refreshed and natural. We don't want to alter the shape of your face or what your actual natural look is. So that's where this less is more philosophy. Start out conservatively and build from there. You want to do this strategically, meaning you want to go to someone who's experienced, has used these products, understands the anatomy and the aging process, so they know exactly where to put them, what levels of the skin are deeper, and to make the best result for you. And then the Restylane products are really interesting now because they've refined these so well that the newer Restylane products actually will move with your emotions. So in other words, when you smile, when you have different animations, you won't see that lumpiness or unnatural look. It will move with your animation and look completely natural. So again, key takeaways here. Both these products are made by a company, Galderma, who's extensively involved in cosmetic dermatology. They've had numerous clinical studies and experience, hundreds of thousands of patients injected. Overall, very well-performing products. As far as side effects, what to expect, most people it's pretty mild and temporary, whether that's swelling, bruising, excuse me, or redness at the injection sites. Again, kind of key points to remember with Sculptra, it's rebuilding your own natural substance. Collagen can last up to a few years. Restylane Contour and Lift are those hyaluronic acid or those water attracting products, and those typically are hydrating molecules and can be more instantaneous results for focal areas. Both products are naturally absorbed by your system, so you don't have to worry about anything. There's no permanent implants being put into your body. The best results are going to come from somebody who understands this process and works with you for a natural result. And with that, we will start taking some questions. A good mention here is that you can book your appointment at any point for a natural makeover. There are some specials going on this month, including one saving $100 off each syringe of Restylane, and then 20% or $200 off each vial of Sculptra. If you're a little bit timid and you want to start very conservatively, you can try one syringe and get $250 off that product. And from there, I'm going to check and see if there's any questions. And I appreciate all of your time. So one of the questions is, will Sculptra help with turkey neck? And so I think that's a little bit of a complex question. In other words, what I think you're referring to is just the generalized elasticity or stretchability of the skin. So it will give you some volume and restore some lift there, but if there's excess skin or tissue, sometimes that does need to be supplemented with surgery, depending on how advanced it is. Just waiting for the next question here. Next question is, can you do Botox at the same visit as Sculptra, or do they need to be separate visits? I think that's a great question, and that's, I think, provider or doctor preference. For me personally, it depends on where we're doing it. Let's say you're doing Botox in the forehead and the 11 lines, and you're getting Sculptra on the midface. I think that's completely fine. I think if you were to do Botox, let's say directly over an area where you were doing the Sculptra, I'd be a little bit more careful with that just because of the potential spreadability of the Botox. But yes, they can absolutely both be combined, and they should. And then one person wanted just a refreshment on how long does Sculptra last? So again, another great question. It's going to depend on the individual. And what I mean by that is a lot of it is dependent on your age. So when we hit, let's say, in our 50s, 60s, 70s, our ability to build that key substance that helps upkeep our skin and helps the structure, the collagen, is not going to be as efficient as if we were, let's say, in our 20s or 30s, but it's still there. So perhaps you would need more sessions and it wouldn't last as long, but it is a cumulative effect, meaning that if you come in and let's say you have 3 sessions of Sculptra over 3 months and you see some really good results by month 6, and you start to notice a little bit more volume loss, which is normal as we get older, and let's say a year. That's the perfect time for a touch-up where you could potentially use a combination of both products and hopefully less because it actually is continuing to build collagen, a cumulative effect. Next question is talking about they love their results with Sculptra with the mid and lower face. They were told they'd benefit from filler on their cheeks to hold up their eye pads. Would you recommend Sculptra or another filler? Again, I think it would just depend on the assessment of your iPads. There's actually, you can get what's called fat herniation or sort of a droppage off, excuse me, of the fat pads kind of going downwards towards the cheek. If it's more advanced like that, something like a blepharoplasty where you actually have surgery to remove the excess tissue would probably be more appropriate. If it's earlier changes, a softer filler under the eyes or enhanced with the cheeks certainly could be helpful. Next question is, would Sculptra fade a lot more slowly than hyaluronic acid? How often are you seeing your patients come in for touch-ups for Sculptra? I would say that Sculptra should fade a little bit slower than hyaluronic acid because you're getting a more robust or stronger buildup of collagen. Now, hyaluronic acid will build collagen, but I don't think as effectively as Sculptra. I wouldn't say it's common to come in for quick touch-ups for Sculptra, in other words, within months, but I think it's not uncommon for patients to have Sculptra and let's say at 9 months or a year, get a small touch-up. Someone is asking if Sculptra will help with eye bags. I think you have to be very careful with under eye filler in general. One of the complications of that is swelling and too much water retention, which these products are very good at doing. And so if you do too much of that, it's actually going to worsen the problem. So again, it depends on how much sagging of your skin of your eyes you have and how advanced those changes are. Other patients asking if they're in their late 40s, which one would you do? Would you book a consult and then decide with the doctor together? Yeah, I think in that case, the whole point of this is to be individualized. I don't think it's based solely on your age. We all age differently. We've had different environmental exposures and genetics. So one person at 40 may need a combination of the Sculptra and a hyaluronic filler. Another patient, let's say even in their 50s, could just use a small touch-up of hyaluronic filler. So yes, I think a consultation, looking at what are your goals, what areas bother you, and then deciding together either a hybrid approach or using one or the other. Can Sculptra in the midface help with the jowls? Um, you typically have to inject Sculptra in the general area where you want the improvement. So if your concern is the jaws or like the lower jawline area, yes, it will definitely help with that, as it did in that first patient we showed who had a couple vials over a 3-month period. It definitely helped with lift and definition of structure there. Just seeing if there's any other questions here. Looks like that is all the questions. I want to thank you so much for joining us. A couple reminders, you will get a follow-up email with a phone number if you want to schedule a consult or the procedure itself. If you have further questions, we're happy to answer anything you have. You'll also be sent a recording of this talk. So if you want to go back and look at certain points, that'll be available to you. Looks like there's one more question that came in. It says, if I do Sculptra, can I cut back on Botox or does that vary? So I think it's important to differentiate. They both do different things. The general thing with fillers, whether you're using Sculptra or Restylane or any type of filler, is generalized volume restoration and definition. Botox or Dysport, those products are great for animated or movable lines. So in other words, our 11 lines between our eyebrows, the horizontal lines on our forehead, these lines known as the crow's feet, those are all great areas for Botox that will soften those lines with motion or movement. I want to thank everyone again for their time. Again, you will get that follow-up email and really appreciate you joining us today.